Workplace Bullying by Melissa Berger, Alexis Graeter, and Kara Riley. Let's begin by watching a short video that shows just how prevalent bullying is in the healthcare field. Our PICO question was, in acute care hospitals, does workplace bullying among nurses increase nursing turnover rate? So what is bullying exactly? According to Merriam-Webster's dictionary, bullying is treating someone in a cruel, insulting, threatening, or aggressive fashion. You could be watching the bullying take place, could be the person causing the bullying, or could be receiving the bullying from someone else. These behaviors include favoritism, belittling, backstabbing, misinforming, gossip, eye-rolling, or many other nonverbal clues. Nursing turnover is defined as the act of a nurse leaving a position of employment. How did the problem of bullying originate in healthcare? The pre-existing hierarchy system, feelings of insecurity by new graduate nurses, the ultimate goal of patient protection, seniority from established nurses, territorial tendencies, and the differences in education, whether it be a LPN, RN, or BSN level nurse. Before we could establish our own approach to diminish nurse bullying, it was important to realize what created or caused the problem originally. The following reasons created or caused the problem of nurse bullying: demand for more bachelor degree nurses, fear by established nurses of being replaced by new graduate nurses due to the large demand for nurses, and normalization of the bullying behavior. There are numerous innocent bystanders that are watching the bullying occur, yet are doing nothing to end the negative behavior. How has bullying in nursing been addressed in the past? Workplace violence training courses have been attempted. The American Nurses Association, or ANA, released a position statement on incivility, bullying, and workplace violence. The Occupational Safety Health Administration, or OSHA, developed the Occupational Safety and Health Act of 1970, and in 2016 created new workplace violence prevention guidelines for healthcare and social service workers. This video will show an example of bullying in the workplace and its impact on healthcare. Oh my gosh, did you hear what that new nurse did the other day?
Oh, yes. He couldn't even put in an IV. How'd he even graduate?
I don't even know. I can't stay in this place. I'm so glad I'm quitting next week. Is this place that bad? Should I be worried about my care? Who exactly does workplace violence impact? Nurses, administration, patients, and their family. It was found that bullying in the workplace and emotional exhaustion all have direct effects on job satisfaction. This, in turn, was directly correlated with turnover rates. The impact on nurses is shown through decreased job satisfaction, reduced organizational commitment, and decreased personal health. Decreased job satisfaction occurs due to harm caused to an individual's sense of self-worth and self-confidence, a mistrust of coworkers, and aggressive or rude behaviors among coworkers. Reduced organizational commitment is caused through the lack of security in the workplace. Nurses who had witnessed or personally experienced horizontal hostility were significantly more likely to plan to terminate their employment. It is obvious that the nurses who were witnessing the behavior felt uncomfortable continuing their employment at an organization that would not willingly protect their employees. Decreased personal health can be caused by both physical and psychological symptoms. Some examples of physical symptoms include headaches, interrupted sleep, and intestinal problems. Psychological effects can include conditions such as stress, anxiety, irritability, and depressive symptoms. The impact on administration can be caused by decreased productivity and a lack of employee retention. The American Nurses Association states that lost productivity related to workplace instability was calculated at $11,581 per nurse annually. This is an outrageous amount of money that these organizations are wasting due to workplace bullying. When discussing employee retention, estimates suggest that the nurse turnover will reach 50% within the first 3 years of clinical practice, and the costs associated with a typical RN turnover rate of 19% in a hospital with 500 nurses will cost the organization between $7.8 and $9 million. The patient and their family is always the number one priority in the healthcare industry. It is shown that the RN turnover is associated with higher nurse-to-patient ratios and compromised patient care. Nurses do not feel comfortable being forced to take on more patients than they can handle, and they will never be okay with the care of their patient being compromised. If confidence and competence decrease as a result of incivility, bullying, and workplace violence, this result can adversely affect the quality of patient care and care outcomes. Clinical relevance. How does workplace bullying impact patient outcomes? Research has shown that nurses who experience workplace bullying can impair patient outcomes by errors in treatment or medication, a delay in care, communication complications, adverse events, an increase in patient complaints, symptoms being possibly overlooked, and the frequent use of temporary nurses. Frequent use of temporary nurses raises concern about the quality of care, patient satisfaction, and morale of permanent staff nurses. Resolution. After evaluating the research, we developed ideas that would be most beneficial in ending workplace bullying. First, we would like to implement classroom education, not online courses that include how to identify bullying and the correct and incorrect responses to the behavior. These courses will provide positive feedback, conflict management training, and appropriate confrontation skills. Then, we would like to create teamwork and staff engagement by advocating for a Bullying Awareness Week. The theme of this week will provide strong mentors, professional role models, and encourage supportive behaviors. Policy improvement is one of the most important changes of all. Developing new written policies, promoting awareness of the policies, training managers and staff in recognition of these policies, promoting a healthy workplace, and thoroughly investigating complaints will aid in creating a successful, bully-free work environment. In order to aid innocent bystanders that encounter bullying behavior, we have created an acronym intervention that teaches nurses how to appropriately react to bullying. We have called this active response STOPS. This will teach nurses how to handle incivility appropriately. S stands for speak up. We want the bully to become actively involved and not ignore the bullying behavior. T is for try to maintain a calm environment. It is inappropriate to make the situation noticeably loud to patients and families who may be in the surrounding areas. O stands for openly listen to their concerns. The person that is causing the bullying may not even realize they are bullying. They may have true concerns. P is for pursue with caution. If the person feels strongly about their feelings, the situation may erupt at any moment. S stands for share with management if not resolved. If the situation cannot be resolved, it is important to follow the chain of command and involve upper management. Letting the situation go will only cause more issues further down the line. The following video will further emphasize stops and its purpose. If the STOPS program does not work or any of the other interventions we suggested, what should we do? Managers need to get rid of marginal employees, just as administrators need to let go of marginal managers. Always consider the drain on total group productivity and turnover that is the result of maintaining incompetence. If these employees and administrators are damaging productivity and refuse to follow our interventions, they must be released from the organization. Conclusion. So, in acute care hospitals, did workplace bullying among nurses increase nursing turnover rate? Yes, our research showed that there was an increase in turnover or intent to leave when workplace bullying occurred. To review, let's look at what we covered today. Bullying is real and can be very serious if not handled appropriately. Bullying impacts nurses, workplace administration, patients, and their families. Bullying can cause medication errors, delayed care, communication complications, and adverse events. Bullying stops here, a 5-step intervention to approach an active bully. Bullying among nurses causes an increase in nursing turnover rate. We would like to conclude our presentation with a video of a nurse actively using the STOPS intervention. Oh my gosh, did you hear what that new nurse did the other day?
Yes. He couldn't even put in an IV. How'd he even graduate?
I don't even know. You all really shouldn't be making fun of him. You were a new nurse at one point too, remember? Let's give him another chance. Today is a new day. Yeah, I guess you were right. We were harsh on him.
Yeah, we'll go apologize.
Hey, we wanted to apologize for being mean before. It wasn't right. If you ever need help, ask one of us. Thanks.